I am Jamaica Tristan Monion, first year, Bachelor of Science in Nursing in Notre Dame of Kidapawan. So I'm going to do a perineal care procedure. So first, what is perineal care? It is washing genital and anal area with medicated water solution. So what is purpose? To avoid bad odors, to prevent illnesses, to cleanse its excretion and secretion, and to promote comfort. Equipment needed during the perineal care procedure is first a bedpan, a loop, warm water, a bath blanket, a adult diaper for patient supplies, a kidney basin serves as your waste receptacles, a piece of paper to wrap the vaginal pads, a sterile kidney basins for your sterile cotton balls, a antiseptic cotton balls and your soap solution cotton balls, and a tissue and your working gloves, and the last is your forceps, but I only have a tongs. G. In entering the room, you must first assess the client's general appearance and consciousness. Good morning, ma'am. I am Jamaica, your nurse for today. So what is your name, ma'am? Your age? Your birthday? So what do you want me to call you? Okay, Dayan. So we're going to do a perineal care procedure. It is washing your genital and anal area to prevent skin illnesses and spreading of germs. So after the procedure, I will document all the results, and the results will be kept confidentially. It is okay with you, ma'am? Okay, thank you, ma'am. And if the clients agreed, so you may now proceed to the procedure. Before going to the procedure, you must make sure that you already wash your hands to prevent spreading of microorganisms, and you must put all the equipments at the bedside in order to have a organization and time management, and you must close all the windows and the doors to have clients' privacy. So we'll put this bath blanket at the abdomen of the patient and roll up the linen, and you make sure that only to expose the external area of the patient. Then after doing this procedure, we now proceed to the dorsal position. So we must do the dorsal position to the patient. The knees and legs are separated, and this is the dorsal position. In the next step, I will wear my working gloves to put bedpan under the patient's buttocks. Wear your working gloves and you must know the size of your working gloves in order to work well during the procedure. Then you must put this bedpan under the patient's buttocks. We must put this bedpan under the patient's buttocks. Okay, ma'am, excuse, can you please lift over? Okay. So this bedpan will collect all the water during the perineal procedure. Next step, to flush the perineal area using this warm water, we need to check first the temperature of this warm water to avoid burns. We can use our wrist in checking the temperature of the warm water. So the temperature is good, so we can now flush it to the perineal area. Before going to the procedure, you must put these waste receptacles under the bedpan. So this is our sterile kidney basin, and always remember that don't allow it to be contaminated, so we must avoid touch in inside surface. So now we will put the cotton balls inside this sterile kidney basin using our forceps. So I will put first the cotton balls with antiseptic. Then I will put these cotton balls with soap solution. So we are done putting the sterile cotton balls in the kidney basin. So now, as we already prepared the cotton balls, we are going to rub our perineal area using to pick this forceps to pick the cotton balls and to rub the perineal area in zigzag motion to maximize this to lower abdomen and put these cotton balls in your waist receptacle. The second cotton balls will rub into your crest groins towards to your knees, at your legs, then to your knees. Also in zigzag motion. The third cotton ball used to wash the inner thigh, also in zigzag motion. Okay. Your fourth cotton balls is used to wash your labia majora, and we can use our two thumbs and one stroke downwards, then put it to the waist receptacles, and our fifth cotton balls used to the other area, then one stroke, then put it to the waist receptacles. Okay. Your six cotton balls used to wash the nucleatoris down to your vaginal opening and downwards, then put it to the waist receptacles. Your seventh cotton ball is used to wash the vaginal opening down to your anus and put it to the waist receptacles. After cleansing the external area using the cotton balls, we must rinse it with sterile water and dry up front and back. Moisture helps to the develop of microorganisms and its comfort. Then dry up from top to bottom in the pot. Then after this, put all the equipments at the side. Then get this bedpan for the client. Excuse me, ma'am, can you please lift over? I will help you. We must put this diaper or a pad to the patient. Then get this bath blanket, then back the top sheet, then make sure that your patient is comfortable. It's done, ma'am. After doing the procedure, you must put off your gloves, then Wash your hands to prevent spreading of microorganisms. Then put the equipments to the utility, and that's all the procedure of doing perennial care. And thank you.